Great. All right. Let me just fix it. Okay. Hi, everyone. Welcome back, or welcome to another episode of TRE in Depth. Yeah, my name is Chandani, and I'm a TRE provider in London. And these webinar series, kind of monthly, free, open space, is to have conversations about TRE and the kind of wider depth, the wider scope of the practice. And so everyone is welcome if they're just curious, but it's also a space to kind of create a space for the TRE community, practitioners, as well as kind of people who enjoy the practice, to kind of come together and just ask questions and understand TRE a little bit more. And that's why we've got Cheda here, who is a very experienced TRE trainer. And I just love picking his brain about all things TRE.
Yeah, hi everyone, I'm Cheda. I'm happy to be here. I enjoyed this series a lot, and exactly what Chandani mentioned, it is kind of a platform for us to join together and to share experiences. And I might have some more experiences in one aspect, or but everyone's welcome to contribute and to ask and so on. And additional thing I would just add, Chandani says, for people who enjoy, using TRE or doing TRE, but also for others who don't, they're welcome too as well. Everyone's welcome, because, as you know, TRE and general life experiences can be pleasurable, but sometimes they're not, and that's absolutely fine. As a matter of fact, we grow from more difficult experiences often, anyhow.
And today we're going to be talking about contraindications in TRE, which I think is going to be, I'm really excited about kind of just bringing up this topic, because at least for me, like when I qualified as a TRE provider, we're out in the world, working with clients, and it's hard sometimes to go back to some of the more parts of the training that maybe are more advanced, or things that just aren't taught in the foundational kind of module 1, 2, 3, and things come up with clients that can be more complicated, kind of above like our current experience level as a practitioner. And so just to have a bit of an open conversation around what the main contraindications are, or some, we're going to explore a few today. And so I was kind of reflecting on this topic, and one of the things that I found has been so nourishing for me as a provider is like having a sense of community. So people who I can ask questions to. I've worked with Cheda over the last couple of years as a kind of he's like my mentor, and so there's someone that I can kind of bounce off when things come up in a session for me, or there's a difficult situation, and also for me to have other like practitioners and community that are like peer groups that I can talk to has been really, really important. I can find sometimes working as a therapist in some capacities can be quite isolating. And so, when things do happen, it's really important that we have some kind of open space where we can, ask these things. No question is too simple or basic, or, so that I'm really excited to explore this topic today. And also, sometimes we see TRE because, some of us have had such amazing experiences with this practice, and I think personally it has been absolutely life-changing for me, but it's also not, a one-stop shop for everything. It's not necessarily the best practice for every single thing that's happening for a person. And so having a bit more of a rounded approach, knowing when to refer certain clients, these kind of things. I think it's great to kind of talk about this a little bit today.
Yeah, thank you. Because often I've got providers coming to me asking questions, and some being overly confident, others underconfident, and that's okay. Please understand certain practice like TRE or any other or any medication can work amazingly some of the time, but very rarely it will work always. And the more we understand human body and brain and nervous system, the basic premise is that many experiences in our life created who we are. So multidimensional experiences. Please don't forget that. So just to say one practice can just change everything forever, you might be disappointed. I do believe, and I know this for myself, that our body needs, our brain, our whole system needs different experiences, and that's enriching. So the deeper we go through TRE or any other practice, different things might come up, and often it's useful to combine with different practices, with different practitioners, and different life experiences. So that kind of is a start or general overview of what we are going to be talking about. I think most of you do know the basic contraindications during your training. So we talked about surgery, recent surgery, injuries, pregnancy, particular limitations, clinical depression, psychosis, schizophrenia, things like that. Just to say, I worked with all of that. Yeah, I don't think there is a single subject there that I didn't work personally over the last 14 years. And with various successes. Sometimes it was successful, sometimes it wasn't. Exactly because what I just mentioned earlier. So knowing your own capacity is really, really important. What I would mention here, a few subjects that often came over the years, and recently we decided to have this as a topic because a number of people ask about pregnancy, they ask about mental conditions, I would call them psycho-emotional conditions, particularly psychosis, pregnancy, I think I mentioned that, and a chronic fatigue syndrome. Often if this is the subject. So, I will go a little bit more in depth on those things, and but please, if you have any questions, do either write in the chat or just simply raise your hands and ask. So to start with pregnancy, the pregnant women most of the time enjoy TRE. That's my experience, and particularly if they have done TRE before, that it's a fairly safe practice to have, because by then you would understand what self-regulation is, you would understand your body movements, and you can work and prime your body to the level that it's needed, and occasionally the back pain, the tightness in the abdomen, in the chest, neck tension, pelvic tension, all of that can be successfully transformed with TRE. However, because often I had many women coming and asking, okay, I want to start TRE, I'm pregnant now. And my answer always is, if you waited all this time now, all these decades to do, wait another 6 months or 9 months. Because if you start working with TRE, particularly in pregnancy, it is fairly complicated on a number of levels, physiologically, hormonally, neurologically, emotionally, and so on. And many things come up in pregnancy. Certain parts from the limbic system, memories, unconscious might swim up to the system. And I don't feel it's the most important time for you to have a detoxification of the big burden that you carried for years and decades. Pregnant woman needs nourishing support, care, and that's really what focus should be. Pregnancy is challenging enough as it is. So if you waited this long, wait a little longer. And particularly post-care in pregnancy, not many people talk about this. So in order to avoid some of the postpartum depression, it's talked very little about post-care and generally before pregnancy, during, and post-pregnancy, post-birth. It's essential to have different support. But post-pregnancy, postpartum, it's really, really beneficial because your pelvis will change, your whole hormonal state will change, emotional needs, sexuality will change. You have a baby. It's a lot going on, and you definitely need TRE. I mean, it's probably one of the most important practices that I would, advise any woman that went through pregnancy, because of the neuromuscular mechanism that we're engaging, through which we're engaging the involuntary movements, spontaneous movements, and some of these structures. So it's really incredibly beneficial.
Cheda, is that even if you were learning it for the first time?
Yeah, the postpartum is fine. Yeah, not. And the reason why I advise against, because not many people understand what self-care is, so they don't feed themselves well. Their emotional conduct, sexual, all of these things are not at the level that women will thrive through. So they already come with certain challenges, and what we know, there's so many miscarriages, particularly in recent years, and so on. And you don't know, is it going to be extra coffee that you had that you shouldn't, that can cause miscarriage, as a matter of fact, or is it particular medication that you've taken, or is it TRE or some other thing? And in order not to risk any of that, also the integrity of pelvic floor, of the womb, the vagina, all of that, it is, it's a big space, important space, and most women really don't know enough about that. And so I avoid, and I suggest, please, educate yourself, and then let's explore deeper, but after the birth. Also, what we are seeing, that the babies are larger, and also there are more complexities in the natural birth and C-section. Some women prefer this, so there are a number of complexities. So I don't want to take too much time on this, but it is, just to conclude, my kind of a starting point is, please don't, wait a little longer. And there are so many other nurture yourself and support yourself with different more familiar practices. So that's one. The other thing which is important with people with mental or psycho-emotional challenging states, someone who is vulnerable, someone was terribly criticized for mentioning chemical imbalance in recent. I've seen something on YouTube. There was an interview or podcast, and I'm actually here to say definitely there is massive chemical imbalance in humans, and that doesn't mean you need to take psychotropic drug or some medication. Because if your levels of magnesium in the blood, in the tissue, is low, for example, or sodium imbalance or electrolyte imbalance, that can cause very serious shifts in your blood pressure, in your neurotransmitters, in your whole profile of biochemical profile. So definitely, we all have biochemical imbalances and chemical imbalances, in different times of the different times of the month. You know this for yourself very well, ladies. So and different estrogen, progesterone levels definitely affect you. So and men had also the cycle. It's not as evident, but we can our mental state or psycho-emotional state changes. If you are especially novice, you don't know if you're facing someone who has some challenges. In the past, if someone carried and they have a low tolerance, window of capacity, very narrow, easily triggered, suffered from different complex traumatic experiences and so on. And what we know, people with psychosis often are contraindicated in TRE. Actually, I would not work necessarily with someone in psychosis, because as you will stimulate the nervous system, particularly brainstem, through some of our exercises and some of the tremoring, that can affect people with psychosis, take them into flooding very quickly, much quicker than an ordinary person. So that goes for anything in a way. Also, if someone is challenged, has particularly challenging experiences in life, please build, those the basics in TRE. So containment, grounding, resources, and self-regulation. These are like kind of 4 pillars that I always talk about. So ground people, create containment for them, sense of safety, orientation, and so on. Then you need to build these resources for them to feel their body, to understand the movements interoceptively, proprioceptively, exteroceptively, to feel the sensations and emotions in the body without being triggered. And then potentially you have extra follow-up step to engage with TRE. And it doesn't mean if client comes to you for TRE and you're not shaking straight away, that's a bad session. Many times I just worked and modified the practice to adapt to the specific client. So, but these are the kind of 4 things that I would say. So grounding, containment, resourcing, and self-regulation. So that's kind of for now what I would like to mention. Chandani, do you have any additions or questions or anyone else?
I just was, as you were talking, I was thinking about, it's quite hard sometimes to know, sometimes we don't even know, some of our history. We're working sometimes with repressed memories. That was my experience of trauma. I buried for many years until 10 years later I had a flashback. So I was like, I didn't even know some of the things that had happened kind of consciously. And so that's one of the interesting things, is that we can, even if you take a detailed case history, we need to feel that we have the level of skill to do some of these more simple parts of the practice, because we might end up in a session with someone who we didn't know some of their, we don't know their history on paper. And so anyway, that was just what came up for me in terms of one of the things that I found since I have my TRE intake form, but that doesn't necessarily mean that you and sometimes people look really, I don't know how to say this. Sometimes people look really scary on paper, and then you meet them and they're great and you have a great session, and they're not, they're lovely to work with. And sometimes people put nothing on their form, but there's loads going on when you're in the session. So we do need to have a kind of balanced approach, that we don't always know yeah, we have to be open to, yeah, all sorts of things happening.
Yeah. That's the whole point about spontaneous movements. We have to be more spontaneous as a provider.
Yeah.
That's part of my reverence for this practice, because and a love for this practice, because it does keep me on my toes all the time, and I learn all the time. You know, I think you after 14 years in particular practice, you would know everything, and then you get surprised, and sometimes unpleasantly surprised, and which is a good learning experience. In some of this, please be aware of transference and counter-transference, really, really important terms that, some clients will come to you and they might transfer things to you, or you might transfer things to them, which is called counter-transference. And that can be messy, but we must not be kind of afraid of, or even if you are afraid of that, I think that's required for us to engage. And it might not be as pleasant. And often that's unconscious, and it takes time for you to realize, actually, I'm transferring and counter transferring with the clients. But the more experience you have, you understand that. And also you can guide the session according to your own skill as well. I mean, you should guide the session according to your skill. And what I mean by that, because some people will go more therapeutically into a kind of a deeper work with people, and others will keep it superficially and on a level of muscular activation and distressing the body simply. And I think that's great. Is wherever you feel comfortable, this is what you should be working, and then venture deeper if you want to, or less deeper if you like to, And that's what Chandani mentioned in the beginning, having reference point. Okay, I can refer you to someone else, but this is what I do, and not feel that you are less or more because you do different things. We all do different things. It was a great saying years ago, no one is inferior to anyone, no one is superior to anyone. We are all unique, and genuinely that's true. And when you see that in your therapy, in life practice, you realize that, when you approach clients with that in mind as a unique system. So chronic fatigue syndrome, that's a big one. And the problem with chronic fatigue syndrome, it is fairly complex condition, I would say, because it is some form of condition. How else would I? There are a number of words to explain this, and some people might feel annoyed by me mentioning that, but or state. And my experience with this, I had a long experience with chronic fatigue syndrome as a naturopath, even prior to working with TRE. And specifically for TRE, what we find that people with chronic fatigue state, they have a good experience initially. They feel great. But if you have a great, and you might go a step further, a few minutes longer, because they feel really good during the process. And what happens, day after, often they collapse for 2 or 3 days. They can't come around, and they are in a worse state than they were before. And that was puzzling for many people. So I'm here just to tell you what my experience and understanding of that is. And then people will work, let's do 2 minutes, let's do 3 minutes, let's do 2.5 minutes, 5 minutes, all of these things. And my understanding and experience of chronic fatigue syndrome is that the main aspect is biochemical aspect, and that some of these individuals have particular low enzymatic capacity to break down particular proteins in the system, and particular toxins and molecules in the system. So these molecules, often we hear about oxalic acid overload, and some of these molecules or phosphates or things like that, they get accumulated in our body. And if they're not broken down with particular enzymes, they stay in our joints, in our tissue, everywhere, really. And if you have the accumulation of that, if your body is unable to process that, that heavy load really weighs down on your immune system, on your whole body, basically, on all of your systems. And so what happens if you start releasing that? And with TRE, often there is a nice lymphatic kind of a drainage that happens, then the nervous system goes from, and in chronic fatigue syndrome, the inflammatory state is the default state. So, if we talk about the ventral vagal, where you're relaxed, some of these individuals have never fully relaxed system. Even if they often will suffer from depression, but that's still inflammatory state, that is still active state. And I will come to that because there is an psycho-emotional element to that. And so just to say, once you mobilize some of these phosphates, oxalic acids, and other chemicals from deeper tissue, initially, you might feel great because kind of your lymph, your blood starts to release, your nervous system starts to change state. But what happens then, as you encourage the release, then so much body says, oh, okay, it looks like I can start getting rid of this stuff. And then offloads the larger amounts of these chemicals. Hence, the day after or days after, they just going to shut down because your body gets overwhelmed. So that's one of the elements that you really need to go very slowly. And that's you release a little bit because they need to address, this individual needs to address the whole kind of a system, the food, the movement, the exercise and all of that. The other aspect of that is that often there was difficulties in utero and during birth and post-birth, and and some of the hypervigilance and hyperactivation and kind of the high arousal of the nervous system was present very, very early. Some of these individuals also might have hypermobility within joints, and that can be a giveaway. And the gut issues. So, and that goes from hardly ever mild kind of serious gut issues to severe gut issues. Yeah. So, and that is, the combination of nervous system and digestive tract that has been formed very early over the long period of time. And often, some of these individuals will push themselves beyond their call of duty. They will try to prove, they will try to, do more than they can. And sometimes you feel them being very active, very sporty, and until they collapse. And the common ground there that sooner or later they will collapse at some stage and will go into depression and a clinical depression in some of them. So to move out of that inflammatory state, this state of overwhelm that causes the deep freeze, you really have to know what you're doing. And it's very difficult. Even if you have experience, each individual is different. So on intake form, and talk to people, find out if they have some of these challenges, and go slowly with them. Genuinely slowly, no matter how well they feel. And you can also warn them that, they might have a little, calm down after the session. They might feel great, but potentially they might have a calm down on, on the level of well, feeling well or feeling good. So, I mean, there is more on that, but just to put in simple words, I think that it wasn't too much, Chandani, was it? Just yeah.
No, and it's it's quite hard with chronic fatigue because physically the practice itself isn't necessarily too much, but it's the healing response, or the longer term response from the body. And it's quite hard to manage the expectations of that, because if it feels good and it has all these benefits, it's quite hard to really pace something like TRE, because the actual practice might feel really good in itself, and so pacing to really check in on a long-term basis, that is quite hard. And because a lot of these, I've worked with a few people with chronic fatigue, and they really want to feel better, and they want to find something that they can have this kind of regular practice with. And it's quite just my reflection on that.
Yeah, exactly. So and there might be different names. People call some similar conditions with different names, but anyone that comes with the massive amount of content, just be cautious with that, because there is a complexity within the nervous system, with endocrine system, with the cardiovascular system, emotionally, all of that stuff. We don't know the history fully. They don't know, as Chandani mentioned before, we don't know fully our own history as well. So, and the way we are conditioned, I want to have few sessions and resolve everything. And the more I work with this, just get the 4 to 6 sessions, trial sessions. They might work, but if people genuinely want to invest into themselves and go any place with anything in life, it's you need to engage a little bit. If you want to go in the gym and get firmer or stronger, you can't expect after one session, So with anything, and I think we haven't been warned enough. I don't think we also had this proper business structure and plan in theory, and that's why so many of us struggle terribly with kind of a successful financial management of our. But I would, after all these years, I would advise, have a chunk of 4 to 6 sessions, and you offer, and you kind of outline what you're going to be working with, and see if that matches the client, and that gives you some safety, gives clients some safety, and in case some of the contraindications are present, or states of contraindication, you can work through that in a way. You can engage with it. But if someone comes for the first session, like, how well can we actually go into the process? So that would be my kind of suggestion and observation on that.
Yeah, definitely. It's really hard in one session to not only address some of the specific things, but also teach the process. There's a lot to talk about and explain, and I find it really hard if you don't have that space and time with people, for sure. But sometimes you need that, like, that first session to give them the taste as well, so that they actually feel curious to work with it over time. So it's hard. It's really hard to balance that. Yeah,
I agree. Yeah, but doing maybe doing suggesting for someone to do the group session, or their online courses and intros. So people, we as a community are developing and creating different possibilities, but just within a realm particularly of contraindications, and then going deeper in complexities of human experience. If you're going to go deeper, 4 to 6 sessions minimum, really. And that's, and it gives you some the signpost, how far can you go with that person? And certainly that will be, I believe, money well invested, because and your own time also giving to a client, because they will learn a life skill that they can, they will go home and use whenever they need to. They will learn about their body in a way they never did before. And I think, we got a fantastic tool in our hands, so just use it wisely. What else? General contraindications, epilepsy. I worked with epilepsy. I had many clients with epilepsy, and I was always on, hyper vigilant, and because it wouldn't be pleasant if that happens. But I never had a problem, which doesn't mean tomorrow someone might come and I might have a problem. But also understanding that epilepsy mainly is triggered by the temporal lobe of the brain, and less with the basal ganglia, which some of our movements are related to the basal ganglia and the brainstem, but seem to be the temporal lobe. Lack of coherence and damage causes more epilepsy. And there could be a number of reasons for that. We have people with epilepsy that had the forceps as babies. They were, had a cranial damage during their own birth. And some people had car accidents. Some people, had particular, and it's always related to trauma in my experience. And it gets triggered when the nervous system goes into some form of overwhelm, and then that response. If you have a epileptic client, you need to go very slowly. And, first of all, you would do that in the individual session. I had a number of clients coming to me in the groups. I mean, when I look back, when I was young and braver, and I could do anything, and I thought TRE will heal everything. Absolutely. Those early stages, and you had a number of people coming, and they had amazing responses. I remember two of them used to come regularly in my groups in Finsbury Park, and nothing quite worked for them as well as TRE. And then the epileptic kind of fits, they reduce greatly. I mean, and there were intensities. It was much less and shorter. But intensity was smaller, and duration was shorter. And again, the exact mechanism, I don't know. I do believe because the whole system really does relax, and you go more into the balance, and kind of this vertical integration becomes more evident and more successful. Then the nervous system does its job normally. There are no short circuits that happen when some of these extreme situations take place. But if people are under-resourced, they are, in overwhelm, carry massive amount of complex trauma, it's a matter of time when someone will be triggered. And so, this work is great, but I would advise against what I used to do. Don't have them in a group session, work with some of these individuals personally. And then if they are more comfortable and they know the practice, then they can join the group.
I guess is there any necessary reframing, because it's this involuntary movement, and I guess maybe a fit or epileptic fit is felt in that way. So it's reframing, this is kind of from a different part of the brain, originating from a different part of the brain, and probably feels very different as well in the body. So it's really interesting.
Yeah, and yeah, with epilepsy, it is totally involuntary, and you go into the faint response, so you are not really present. So it's very different to the neurogenic tremor that is fairly pleasurable, and you are, moving from the ventral state to the maybe, sympathetic arousal, but you never go into the um, faint or really deep unconscious state. So, and yeah, knowing more about the brain networks and complexity, it's fascinatingly beautiful and majestic. So, but I do believe any of these injuries of these fits are caused due like essential tremor. We had some amazing, people say, "Oh, don't work with these people," but we had some amazing successes with that as well. I didn't necessarily heal the essential tremor with many of my clients, but definitely reduced the essential tremor. And if you look over the months and years that I worked with some of them, there was always some early childhood stuff that happened, and then it got triggered by some shock trauma and so on. And then how you develop, how the brain develops, that's becomes pathological for some, unfortunately. Yeah. Any questions? Any comments? I realize them in the dark. No light, let there be light. Rachel.
Hi, yes. I can't find my electronic hand, so I have to use old school. I had a question the other day from a client who has quite a lot of anxiety around health, many health conditions, and she hasn't actually done TRE yet. She wants to know, can it trigger epilepsy? Now, yeah, over to you.
Okay, thank you. I mean, I can't guarantee that it can't, because we never had that reported from 7 million people, over 70 countries that triggered epilepsy. But I'll go back to what I said very early. You just don't know with pregnancy, with some of these conditions. People are vulnerable in vulnerable states. Part of their brain might connect that with kind of the epileptic response. Unlikely, but we can't say 100%. So if someone is in a doubt, better not, don't do that. Don't do it yet.
Yeah, I would say that rather than having doubts, it's more about anxiety about everything. So this is somebody for whom any small possibility becomes magnified. And that's really something that I'm working with this person on anyway. My intuition is that it won't be a problem, but that it is a problem for that person to think of it, rather than it being a problem in actuality.
Absolutely, yeah, I'm with 100%. But if you're already working with her, once the anxiety states will kind of diminish and they expand, there would be more space, hopefully, in the chest area, in the body, more interoceptive awareness. Breathing patterns, particularly through the nose, will enhance and so on. So she will have some skills to engage touch. All of that really decreases the anxiety.
Sure.
And
Yeah.
we have more skills and less anxiety towards trying something different.
Yeah, great, thank you.
Yeah. Often people ask with limited kind of a mobility, ask, can you do TRE, and or after particular injury. I think that's also useful to understand. So to me, if you do yoga or some form of movements, you can do TRE absolutely. If you're very limited, we can adjust. I mean, there are practitioners who teach how to do TRE on the chair, for example, and people with serious limitations and so on. But this aspect of lack of mobility, I would be slightly cautious, but I wouldn't be overly cautious with that. So just if someone can, go for longer walks, have a run, in the park, or do yoga, or some practice, the TRE would be, I would advise to try TRE again. Caution, but try TRE.
Can I actually ask about TRE and pain?
Yeah.
Someone's already experiencing, I don't know, chronic pain or acute pain, because I guess, with self-regulation, they're already over. And that always was like a curiosity to me. It hasn't come up too much in my practice, but that, because it can be great for pain. So it's like a kind of interesting balance, especially if you were a new provider, because you need to really tailor the practice to their body. I don't really know how to phrase the question, but I remember when I initially started I was like, well, if someone's already experiencing pain, that's like they're already past the 7 out of 10 or that kind of, they're above that already.
Yeah. I would, we can be very successful with pain as well. And I think there are a number of elements here to talk. Pain is complex. What I would, first localize, where is the pain? What kind of pain? Is this clear? Solely physiological, or there is emotional content to that, or is it biochemical, or there could be a number of things, and often all of them together. But what my experience with pain is that it diminishes. TRE helps the reduction of pain globally. For back pain, we had some, countless people. I mean, I worked with over at least 100 people. After a session, the pain was gone, like hundreds of them, including my own experience with pain. It might come back again, and but in a different way. But the TRE experience will definitely change your state. Pain is also related to a sense of safety as well, because we experience more pain when we feel unsafe. So, I might cut myself, and there is no necessarily much pain, but the more blood I see, the more fear I have within me, sense of safety. Suddenly I start feeling, more pain and etc. And with our polyvagal theory and application of some of these principles, your containment, your eye contact, your prosodicity of your voice, this whole safety element definitely will soothe the nervous system, because these nociceptive processes that go from the brain towards the area of the painful area will diminish the intensity of the transmission of that information that is dangerous. Actually, you might re-experience your body in a different way, but that also can be biochemically. The shifts, some of the cytokines that might be working on certain receptors that provide some of this nociceptive information, you know, they might really reduce intensity of that exchange, and you might find that area feels, you know, softer, more relaxed. The lymph system might drain particular residues there, so you can have a number of benefits there through TRE. So I definitely would encourage, always caution, always kind of verifying with the clients, you know, what's going on, and so, but you know, if not debilitating pain or some extreme pain, you know, I definitely would engage. Yeah, we had a lot of great experience with the pain in various range of experience there. Yeah, just to say, this will be also recorded. This is recorded. I mean, it will be on the YouTube channel, so you know, for free, so anyone can watch it and can revisit if you want. And like all the other conversation, they are all on the YouTube channel. So, and I hope this is kind of a resource as well for you. You know, you can revisit and apply, and feel free to connect. And you know, if you need something, if you have questions, I don't know, I'm not the fastest in responding. It depends where I am. You know, my life is fairly hectic, but you know, I'll do my best to respond. And Chandani is here as well, so we'll yeah, trying to create a space for you know, deeper connection and some nice neutral exchange. Any other comment or question? Okay, if not, let me just give you some more news on. I think that's, you know, the main highlights of what we wanted to cover. So I will be teaching a primitive reflexes workshop mid-July, and I'm very excited about this. It's a new arena, new area of exploration, and I think any practitioner will gain valuable knowledge about themselves and how to work with and some of the serious neurologists and serious players in the world are engaging with this more, as we're seeing a lot of neurodegenerative issues happening, and primitive reflexes they don't seem anymore to be, they are really one of the fundamental blocks of our whole brain and nervous system development. So that's going to be mid-July. We're going to have another conversation, TRE in depth, 31st of July. We will send this out more, and it's going to be TRE and sexuality. That is the subject often mentioned, and you know, no one is talking about that, so I'm going to talk about that. So we need to really talk about that. And then end of August, again, slightly related, similar but slightly different focus, will be TRE and PMS, hormones and changes. And we'll focus mainly on female and on male as well, but as over 80% of all providers and clients are female, so you have priority, so I'm pleased to say. So we're going to be exploring that, because again, I have so many questions on that, and why TRE is so phenomenal for hormonal balances, changes, for your own understanding of your body, of your sexuality, of all of this, and how you change as a woman, and how we change as as beings is so fundamental and useful to have some insight into that. So these are the kind of future events that are taking place.
And we're definitely open to receiving any suggestions as well. If there's a topic that you want us to cover, we can schedule that as well. Yeah, great. Well, thank you for joining us. And we'll see you hopefully in July.
Yeah. Thank you very much. Yeah. See you soon. Bye.